Our guest for a Healthy Friday conversation is here. Dr. Catherine Nyongesa is a clinical radiation oncologist at the Texas Cancer Center in Nairobi, and she's in the hot seat of the Situation Room this morning. Good morning, Dr.
Good morning, and thanks for having me.
How are you?
I'm good, thanks. Happy New Year.
Happy New Year.
Yes.
Yes. We will say that. Dennis tells us we will say Happy New Year until Valentine's Day, so we're still good.
Yeah.
Yes.
Thank you.
Karibu sana to the hot seat of the Situation Room. It's hot topics that we're discussing this morning, especially on this Healthy Friday conversation. But we'd like to welcome you, to the Situation Room with a proverb. CT has proverbs that he gets and collects every week from a different African country. This week we're in this unique country called Kenya, and CT, will you welcome Daktari with a proverb today, and then what you would see. Now, doctors are always busy, and you're always telling people what to do. Treat this, do this. Now we're going to ask you to do something for us this morning. Listen to the proverb, interpret, tell us what you think about it and how you would interpret it. Is that all right?
All right.
Okay.
The thing about Kenya has many unique features. But one of the unique things about Kenya is that if you're looking at sub-Saharan Africa, it is said it has the third largest economy. It is said. I'm saying it is said because up until recently, Tanzania came up and said, something, we have actually taken that third spot. The third spot is after Nigeria and South Africa. So, but apart from that, we are known for our middle and long distance runners. We are known to have had the first woman to win the Nobel Peace Prize on the continent. And when you're talking about the cradle of mankind, where it is said by people who study, who participate in this discipline, we have records of probably having some of the oldest fossils of human beings found on the planet. This is not now a continental issue. It's an earth issue.
The Turkana boy.
Yes, exactly. All right. Now, the proverb. Our proverbs are in the language of Kiswahili, our national language. Kupotea njia, ndio kujua njia.
Okay, so I answer it in English.
Yes, that's what you think it means, and then how you can apply it.
Okay, sometimes I think it's about lessons learned.
Yes.
Yeah, when you do a wrong thing and you are corrected, you actually now learn the correct way of doing things, and we always learn from the past. From our mistakes.
Absolutely.
Yeah.
You put it very simply and it's very accurate. Thank you.
Thank you very much for that. Yeah, great. I mean, we learn from our mistakes. We should as well. We're looking at some complicated issues this morning when it comes to Health Friday. Cancer, of course, a big issue. Over the last couple of years, we've seen cases of cancer rise significantly in this part of the world. And when I say this part of the world, I mean Africa. That in 20 years, cancer has done the damage in a way in which it never did before that. We were dealing with other things. We dealt with the polios, we dealt with malaria, we are dealing with HIV and other, a lot of tropical diseases. Cancer as a non-communicable disease, however, made its debut on the African stage and has claimed a lot of life, has claimed a lot of health. And then we now deal with this disease, which also marries with care-seeking behavior, which we see is significantly less with men. And unfortunately as well, we deal with cancer in many cases where it has already reached a stage where it's difficult to manage. All of these factors coming out to play in this conversation that we have this hour. And as we look at cancers in men, their treatment and prevention, Dr. how about we start off with what are these cancers that affect men? First of all, which ones are they?
So thank you. Cancer is a complex disease. It's not just one disease.
Yeah.
So it's when we look at men, we're looking at maybe the most commonest cancers. We see prostate taking lead, followed by esophageal cancer. Others include throat cancer, colon cancer, and we have blood cancers or leukemias. They also affect, but on a less scale. We have lymphomas, we have kidney tumors, basically any part of the body actually you can get a cancer.
Okay.
But I can maybe highlight the commonest one being the prostate and esophageal cancer.
Okay.
Yeah.
So the prostate, obviously, it cannot affect anybody but men because
men have the prostate.
Exactly, just like how we see cervical cancer in women.
Yes,
you will have if you do have a cervix, you will get it, right?
Definitely.
Or rather, if you have cervical cancer, you must be a woman to have it.
Yes.
Okay, that's what we're looking at now. So if we're talking about prostate cancer being one of those big ones, how do we see its manifestation in men, and what is the burden of prostate cancer in Kenya, for example?
All right, so in men it will manifest with the symptoms of lower urinary tract. So this include difficulties in peeing, even in shedding the pee. You may have poor stream. You may have even obstruction. The urine may not come out. You may see blood in the urine. Sometimes also, if it's untreated for a long time, it can spread. So men will come with back pain, paralysis, and also other parts of the bones might ache. It can spread to the lungs, the liver, and the symptoms will manifest in those organs. But the commonest presentation is those lower urinary tract symptoms, which are also part of aging. So it's a disease of the aging. And in these men also they have what we call benign prostate hypertrophy. The prostate is enlarged because of age, and the symptoms are similar. So it needs a medical diagnosis to rule out whether it is just a big prostate because of your age or is it cancer.
How do you know? I mean, I think of sometimes we just have to use a comparison in order for us to, get into the real issues. So like for breast cancer in women, which they said, you don't really know until you know. So the campaigns went crazy and they said, touch them, get somebody to look at them often, every day when you're taking a shower, or even before that, make sure that there's no abnormality. Try to see what's going on. What would you do in this one with men, for example? What are the advices for you to check and know? For cervical cancer, they say get a pap smear as you get older, get one every year. What are the methods, or what are the sign checks for men in this particular prostate?
So on statistics, actually we see close to over 3,500 new cases every year. And how do you check for it? Number one, it's a disease that is likely to affect men as they grow older. In fact, they say that maybe if you live to 90, most likely you may have prostate cancer. And many people are dying with prostate cancer and it's not causing them problems. So some of the cancers could be very mild, not aggressive, and you can live with it without treatment. But others, we always say early diagnosis is always the best. So you'll, if you have symptoms, it is good to go to the doctor to be checked. You can also be proactive. You don't wait for symptoms. If you are over 40 and you have a strong family history of prostate cancer, it is good to go for early screening. Otherwise, we recommend it more for men above 50 years. And when you go to the doctor, they will check your blood for, there's what is called PSA. It is a tumor marker that is actually can be found in blood. So when it is raised, it is high, it could be a red flag that you could be having prostate cancer. Another one will be maybe to the doctor to examine. They have to put in a finger. The beauty is we can access your prostate through the backside, through the rectum. So they put a finger to have a feel of this prostate. Is it enlarged? Is it nodular? Like, it's not smooth, or is it smooth? Because when it's nodular, the chances that you could be harboring cancer is higher than when it is a smooth prostate. Also, when it's enlarged, it is a red flag. After that, now the doctor will move you to the next step, which is a biopsy. So they'll take a biopsy still through the back passage, push a needle into the prostate and take some bites of specimen and then go to the lab and they'll check. And if it is confirmed it's cancer, then you'll be ushered into next steps.
These processes are very intrusive, aren't they?
Yeah, that's the thing.
They're intrusive, but they can save your life. And not that very intrusive.
I am thinking of the pain that I would endure if someone was shoving a needle up my rectum.
Why don't you say it like that?
Yeah. It will be done and you'll be given some medication to be comfortable. So you'll not endure that pain.
I'm being facetious, Dr. What I'm leading to is this. The discussion around cancers has increased over time.
Yeah.
The question that often swivels in my mind is, these cancers that we speak of, are they just a normal occurrence that with age and time have always been there, or are we seeing an increase in incidences of cancer? And if we are, then what is it that is bringing about these issues? Because the discussion around cancer is there because we are hearing, experiencing, knowing more and more about the disease.
So cancer has been with us for many years. Just that maybe those days people used to think it's witchcraft. It's a disease of the women. Like for cervical cancer, in fact, in my village, people say, that is a disease of the women. Breast cancer has been there. Prostate cancer has been there. And if I look at, say, Kenyatta National Hospital, the cancer center is about over 55 years old. When their books, our predecessors had photos of patients with cancer. So it actually shows cancer has been with us. But why are we noticing it more? Because we have more awareness. Population is increasing. Lifestyle is changing. We are adopting the Western lifestyle. There's a lot of use of tobacco, alcohol, sedentary lives. We have cars. If you go to... I remember when I was growing up in the village, you could take you'll walk a long distance before you see a neighbor. But now you go back, you'll be lost.
Everyone's
what has happened? There are more people, isn't it? In fact, your neighbor is a stone throw away. Yeah. So what does it mean? When the population increases, then we are likely to notice that the cancer is actually increasing. And then also aging population, people are living longer, they are taking good care of themselves, and also the longer you live, the chance that you might get cancer along the way.
Now, Daktari, as we talk about prostate cancer, to be specific, you find that men don't seem to be seeking advice, rather going for these screening to know exactly where they are with regard to prostate. Why would that be the case? And could the intrusive nature of these tests be one of the reasons?
Yes, it is possible, but I think statistics also are showing that cancer is reported more in women than men. In fact, in our country, 60% are reported in women and 40% in men. So it could be the true reality that cancer is more common in women than men. But others is that the healthcare seeking behavior is higher in women. Why? Women, we are always taking our babies when you are pregnant, you are interacting with doctors in hospital. When you give birth, you take your baby always to clinic until the child is 5 years or more. So this continuous interaction with the healthcare gives women an opportunity to even ask questions to the doctor. And if they're unwell, they'll tell the doctor, please check. And probably that is what is happening. But in terms of also health-seeking behavior, men feel like they always humiliate. I see that a lot. It is hard to get a man to hospital and take him to the next visit. It's not easy.
No, we don't go to hospital voluntarily.
Yes.
No, we normally
kicking and screaming, bound and chained, perhaps.
Or probably you've collapsed.
Or on the deathbed.
You're not even aware you're being taken.
Because when you take him, you tell him now tomorrow we have to go. Once they feel a little bit better, they're like, no, I think I'll wait. Yeah, but women, I mean, they're always interacting with doctors, so yeah.
Okay, we are this morning joined by Dr. Catherine Nyongesa, and we're looking at common cancers in men and their prevention strategies, how to go about. So I just thought about it as we're talking about healthcare seeking behavior is a challenge for men. So it looks as though it's a double whammy here, where you have to say, first of all, you're already predisposed to not going to seek care. And then here we are saying that cancer prevention is a high percentage of your personal efforts, right?
Yes.
To be able to check yourself and to say, I will take myself to be screened for whether invasive or non-invasive. But we're already dealing with a group of people who naturally will not go and say, check if there's something wrong with me. So it would appear as though the prevention strategies then would be a lot more difficult to deal with, especially for these cancers found in men. How then are medical practitioners dealing with that particular issue, to say one of the only ways you can do this is if you yourself as an individual are vested in it? How do you deal with that?
So one is creating awareness the way you are doing. And then another strategy is just preaching about health lifestyle. Avoid using tobacco. And if you have to smoke not in the house where your children are. Encouraging our women also to talk to their spouses, because when your husband is smoking, you are also a passive smoker. And also probably trying to understand what is in your conversation. I mean, I'm just curious, as women, when we are in a conversation, we are talking about our health, our children, our husbands, ourselves. I don't know what you meant. Talk about in your little groups.
Our wives.
Everything but
But
you're trying to imagine a WhatsApp group with all these men who hang out, and they're talking about, well, there's investment here, we're going to go and buy this shamba. They're talking about how this woman has stressed my life.
Yes.
The likelihood of them saying, guys, how about every month we have a hangout checkup, for example? How about every 6 months? The likelihood of finding that conversation is close to nil.
You see, they're saying they're talking about their wives.
Actually, we are fairly represented here. It's a 50-50. So this matter of what men discuss do. Can you let us tell you what we discuss?
Okay, CT, do you guys in your WhatsApp groups discuss how you're going to go to hospital every September, for example?
Actually, you seem to know a lot about what we discuss.
Because I'm one of the boys.
Let me disabuse you a little bit. Okay? The things you say are the things that women think men say.
Okay, here we go.
Yes, exactly.
Yeah.
We do discuss all these issues. It's just that we discuss them in smaller groups. People whom you're close to and people whose opinions you value. And so we do talk about these things, and we do reference, because we have friends who probably have been unwell. Some have had problems with cancer. So these discussions do come up, and we do have them. But we don't freely talk about issues the way women do.
Okay. So this is interesting, Tari, because if that's the case, if there is smaller groups, smaller caucuses of gentlemen who are saying it's important for us to do so, because I do think that over time the awareness has increased. I think we see the manifestation of that. Wouldn't we then see a reduction in either folks then who have to go to hospital to manage care, to manage disease, or would we then see an increase in the number of men who present themselves to hospital for checkups? Would we see that if these conversations are happening?
I think there is positive impact. We're seeing more men coming forward for screening. As a matter of fact, this January is Cervical Cancer Awareness Month, but we don't let out men. So when you go for screening, we encourage men also to come. But the unfortunate bit is that because of the poor health-seeking behavior in men, looking at prostate cancer, many of the patients are coming with late stage. So, but with more awareness, if we encourage them to come early, because cancer is more curable when it's diagnosed early than when you wait when it's too late.
There's also an issue here. You see, the understanding of illness as far as we Africans in Kenya are concerned, if I'm not feeling unwell, if I'm not feeling pain, then I am not unwell.
True.
And if I am feeling pain and the pain is reduced, then in my mind I am better. And I will probably even stop taking the medication because I'm now feeling, I take the medication so that I can be well, so that I can feel better. Okay? Then, when it comes to care-seeking behavior, there is always the balancing of resources. Many men, not all, many and not most, many men also have the task of looking after their families. So when they balance the resources that they have vis-a-vis going to hospital, they will figure out and say, since I'm not feeling that bad, it is okay. Let me attend to other things. I will eventually go, and they eventually don't go because there's the factor of the disease progressing and you getting sicker. So by the time you're being taken, you really are very sick and you're actually at death's door. So these factors tend to have a very, very profound impact on the decision-making process. Yes.
But then, even as the city brings that up, there is always the conversations around the need of just going for a checkup yearly or monthly. So how then do we converge all these conversations to at least have men show up for a full body checkup?
Yeah. So, in Kenya, we see infections taking lead in terms of causing morbidity and mortality. Then cardiovascular diseases. Cancer is like number 3. So what we are saying is take a proactive step in your health by being screened for high blood pressure, diabetes, because those are like the worst, and they can be managed and you live a healthy life. Now with cancer, there are certain barriers that prevent men from seeking healthcare. He's told us about economic barriers, so he's really balancing his finances. Others are physical barriers, like you don't even know where to go, for this screening. And then the other barrier is psychosocial. There's also stigma. Someone feels like, if I tell my friends maybe I have cancer, they look at me differently. They may even go after your wife. So, So it hinders them from seeking that.
But those are, I just had a like that. Sorry, as you say that, I had a moment. We laugh about it, but it's actually true.
Yes,
those are some of the reasons that would prevent somebody from actually going. Number one, talking about it in public, because it is a big issue, or even going to seek, medical care, because you're saying, you know what, it is not just a medical issue, it is a social issue as well, and plays a lot also on your psychology as a man, because we know, and so sometimes we might override the effects that it actually does have and not see why it would be so difficult for a man to do this.
True.
One of the things that we saw, and people complained about it when HIV made again its debut, and one of the communication strategies was to show the horrific pictures of what happened to folks who had been infected with HIV. Many said it was victimizing and things like this, but the effect that it had is that it served as a deterrent, or it served as a way for people to go and actually check and make sure what their status was. And although it's been frowned upon, it's still a tool that communicators use to say, let me show you the effects of this disease as a way to make you more careful about your behavior. Now, with things like cancers, when we talk about what would happen in your body with a cancer untreated, what are some of those things?
Like prostate. We are seeing a lot of men coming in wheelchairs because it has spread to the bone, affected the spinal cord, and you cannot walk. And then a lot of pain. With the esophageal cancer, you can hardly swallow. Yeah, usually it starts, you may not swallow ugali, then you change. You tell your wife, change this diet, then they make it more softer. But by the time you are getting to swallowing liquids only, it's a problem because you've lost weight, you don't have energy. When you come to colorectal cancer, they present with obstruction, so you may not be able to go to long haul. And these symptoms, we call them altered bowel habits. You have diarrhea, constipation over a long time, and many people ignore that gut feeling. It will be good when you have these symptoms to go for checkup. Don't just be told maybe you have hemorrhoids. So those are some just of the common, but the list goes on and on. You can have breast cancer. Men can also have breast cancer because they have a breast, and they'll present with a lump in the breast. So with the time, all cancers, if left untreated, can spread to other parts of the body through the blood, go to the lungs, cause havoc in the lung, go to the liver, cause havoc. But there's hope. And the hope is that just like HIV was managed when you take your medication, cancer can also be controlled if you go for, you adhere to the doctor's prescription and also join support group, that there's always hope. So it's not just like it's a death sentence. We have many patients who have been treated for cancer and they are doing well.
There's always this daunting reference to cost when it comes to the treatment. But then, of course, there is the prevention that one, or ensuring that you manage it before it gets to the point of. How do you balance this? What is it that is needful for people to know and understand well ahead of time? And where would one go if one wanted to have some cancer screening? Is this something that is available in our public hospitals? And if so, at what level of public hospital?
Actually, screening is available at all levels of the healthcare system. And with screening, you don't have to go every month, every week. You can go once a year, and depending on the doctor's recommendation, then they can spread it out even every 2 years, every 3 years, depending on the risk they found. But having said that, different hospital levels have different capacities. So maybe you can go for just checkup. It's possible in level 1 and 2. But if you need more advanced intervention like biopsies, then you'll be referred to higher levels of healthcare. You can also walk into a doctor's private clinic, but a consultant, you tell them, I'm a dick, I just want full body checkup. Check me if I have any problem. So help is around us. It's just that we don't notice, but it is possible.
With NHIF, one knew how to navigate. I have heard some positive things about SHA. I have heard. But what I hear is predominantly not very positive. My thinking is that with the new system, there'll be problems which are teething and they may go on for some time. However, if you are talking about the prevalence of cancers that are prevalent in men, where do we find many of these cancers? Because when you talk about the manifestation of it or the numbers, there will be places. Is it in urban areas? Is it in rural areas? What sort of places? I mean, with every disease, there is a predisposition towards certain things. And if so, in these particular areas, is help also readily available?
I mean, as I told you, we still have barriers. We are a developing nation. SHA has its own teething problem, but it's promising. I've witnessed it paying for patients with cancer for surgery, chemotherapy, radiotherapy. So it is still catering. In terms of our screening, they are also extending it to hospitals so that they can be covered. So it is not all gloom. It is possible, but I'll encourage people to enroll on SHA, because many of us, people wait until you are sick, then you scramble. But it's good to enroll early enough so that in case of anything, you get urgent care. In terms of prevalence, we say prostate cancer. Actually, we see patients from all counties, but it's a disease also more prevalent in urban areas because they also say obesity, sedentary lifestyles could predispose one, and then a positive family history. If maybe you have genes running in families, and that one you can't run away from. Things like esophageal cancer, we see it more common in Bomet, in Mandera, Wajir. We don't know, maybe there is talk of hot beverages. It could be a possibility, but there's a genetic element also. If now we look at women, cervical cancer is caused by human papilloma virus. So this is a virus that we acquire through sexual intercourse. And that is why the government is now pushing for vaccination of children. We've started with girls, but in future we'll extend it to boys because there are some throat cancers which also are related to human papilloma virus in men, and some genital cancers also related to human papilloma virus.
Is it true that if you talk about cervical cancer, that the predisposition to cervical cancer is greater in populations where girls are married at a very young age, or their sexual debut and the continuation of that particular activity at a very young age is prevalent? Is that?
Definitely. Why? Because these girls are exposed to the human papilloma virus much earlier. And this virus can stay in the body for 10, 15, 20 years before it causes cancer. So the earlier you are exposed, when at a younger age, the chances are very high that it will cause damage more over time. So you find maybe they are presenting now, but they were married or earlier. So multiple sexual partners having genital tract infections can contribute, and obviously 99% of them are due to HPV, which is preventable, and this HPV can also cause cancer in men.
Okay. Now, Doc, let's talk about investments into the health sector, and especially let's talk about research and development, especially in cancer-related cases in the country. The government always comes up with the budget, but how much of that goes into research and development, especially around cancer?
So there is a push towards prevention and research. As a country, we are still grappling with treatment, which is very heavy. But as we go onto more awareness, we'll see this impact many years to come. We may not see the results right now, but it will come to pay in future. And research, there's a deliberate effort to invest into research. And I can tell you, in a university, like say University of Nairobi, Moi University, Jomo Kenyatta, KU, all those universities, if you are undertaking a medical course at a master's level, you must do research. It's a prerequisite for you to before you can pass that exam. So it is a deliberate effort. I cannot really quantify how much money, but it's a small proportion. I can say that we are investing more, we are using more money in treating and less in research. But as time goes on, more and more is going to be set aside for research, so that we know actually what is causing this cancer in our patients. How do we manage it? What is the best treatment? And also as a way of preventing cervical cancer, we see it more in lower socioeconomic status. And I think educating women, it is very important, because then they can take control of their sexual health and make right choices. Yeah.
Sadly, our universities, let me talk about the public universities, are not citadels for research. People, yes, will undertake research because it's a fundamental requirement if you're doing a master's degree or a PhD. But beyond that, grant writing, ensuring that you actually get money to focus on a specific area of research, it is done, yes, but what universities elsewhere do, we are very, very, very far away from it.
Definitely.
Extremely far away from it.
I mean, I think there's so much, and that's why, the medical fraternity, in line with governments, when we look so, far into the Abuja Accord and all of the things that were done, protocols that were suggested in terms of what research ought to do, I think there's still a lot of work to be done. But if I may ask, what would you say is the scorecard for treatment of cancers if we're looking at these ones that affect men? And I think that could be an encouraging factor for a lot of people, because they say, look, why should I go and check if I'm already doomed, I'm done? But if we look at how treatment can actually help, what are we looking at in terms of, how far treatment can go, how well it can actually be implemented to make sure that we're on the right path? What's the scorecard for treatment of cancer today?
So we, as Kenya, we are part of the global village, and we are using international guidelines in treatment. The only unfortunate thing is late presentation, and that is why you find some of the outcomes are not very good. But for cancer care, you look at the goal of care. It could be radical or intent to cure for early stages, so you go in full, and we've seen patients getting healed. If the cancer you present in late stage, then there's still hope, but the goal of care will be palliation, for example, and this is to improve your quality of life.
Right.
Yeah, you find patients come screaming in pain, but after treatment, the pain is gone. I mean, you live a better life, pain-free. Another goal of palliation, probably, you could be having cancer that has spread to the spine with the cord compression. So when you get radiation, it can reduce that. But the bottom line is early diagnosis. Early diagnosis, and our cure rates are going to be higher in future compared to now, once we get more and more people presenting in early stage and not fearing that cancer is a death sentence.
Do we see the burden of cancer in younger men now than we did before? Just looking at that quickly to be able to understand.
No, still the burden is higher in older men.
Okay.
There are also myths out here. I don't know if it's a myth or if it's true, and it has also been asked by one of our listeners, that men who tend to stay away from sex for 3 to 4 years tend to have a higher risk of getting prostate.
That's a myth.
It's a myth, but that has been debunked.
That is a myth. Okay. I mean, one of the things that we go away with today is actually ensuring that early screening is done, an acceptance of the fact that it could happen. It could happen to you. Taking in lifestyle remedies, making sure that you're doing the right thing at all time, but then seeking care. And I think we've harped on men today, and I think it's important that we did. But then women also, interestingly enough, from our listeners today, asking fellow men, guys, do this for us as women. Do it for us. Go get screened, check and make sure that everything is all right. And just like you said, Dr. it is possible to have this, found early, treated, and in many cases prevented as well.
Yes. Yeah.
Thank you for sharing this with us this morning. And I think, again, these are some of the things that we can't stop talking about, because it's actually very, very important to have optimal health. Dr. Catherine Nyongesa is a clinical and radiation oncologist with the Texas Cancer Center in Nairobi, and she's been our guest this hour on our Healthy Friday discussion. Go out and get yourself checked. That's a message that we can end with today. Thank you very much for being here this morning. Asante sana, Dr.
Thank you so much, and I think we should be each other's keeper. So the man to be the woman's keeper and the woman to be the man's keeper, and we encourage each other to go to hospital.
Indeed.
Indeed.
This is the Situation Room, the only way to start your day.